Now question number 1, derivative of vitelline vein. Vitelline vein के derivatives क्या है? IVC, SVC, ligamentum venosum and the ligamentum teres. So in this diagram you can see this is the vitelline vein and this is the liver. So here the correct answer is A, inferior vena cava. Now the next question number 2, Sternochondral joint is कौन से टाइप का जॉइंट है? स्टर्नोकॉन्ड्रल, प्राइमरी कार्टिलेजिनस, सेकेंडरी कार्टिलेजिनस, फाइब्रस वैरायटी ऑफ जॉइंट और द साइनोवियल वैरायटी ऑफ जॉइंट. So this is the sternum and these are the costal cartilages. So this joint, it is the sternochondral joint and it is a primary cartilaginous joint. Now the next question number 3, sweat gland near the lid margins. Glands of Moll, Zeiss gland, meibomian glands or the cross glands. So here you can see these are the meibomian glands. So meibomian glands and the Zeiss gland, they are the sebaceous variety of gland, and glands of cross, they are the accessory lacrimal glands. So here the correct answer is glands of Moll. The small glands, these are the apocrine variety of sweat gland. Now the next question number 4, anterior lymphatics from the nose drain into. Options are pretracheal nodes, submandibular nodes, sublingual nodes or superficial cervical nodes. So these are the submandibular nodes. So this anterior lymphatics from the nose, it drain into the submandibular nodes. Now the next question number 5, Appendices epiploicae is seen in all part of large intestine except sigmoid colon, ascending colon, cecum or the transverse colon. So appendices epiploicae means what? So it is the characteristic of large intestine and these are the fat filled peritoneal pouches. So they are absent. Where they are absent? They are absent at the cecum, at the appendix they are absent at the rectum. So here the correct answer is cecum. Now the next question number 6, innervated structures of joints are all except. इनर्वेशन कौन से स्ट्रक्चर्स में नहीं है, यहाँ पे हमें ये देखना है. सो साइनोवियम, कैप्सूल, आर्टिकुलर कार्टिलेज और लिगामेंट्स. सो हियर यू कैन सी दिस आर द आर्टिकुलर कार्टिलेजेस एंड दिस आर द साइनोवियल मेम्ब्रेन. नाउ दिस आर्टिकुलर कार्टिलेजेस, it is hyaline variety of cartilages. There is no blood vessels, there is no nerves, so they cannot regenerate even, right? So here the correct answer is C, articular cartilage. It is not innervated. Then question number 7, not true about inferior extensor retinaculum. Options are Y-shaped, B, superior slip attached to lower end of fibula, C, inferior slip attached to deep fissure of sole, lateral attached to calcaneum. So here you can see this one is the inferior extensor retinaculum. So it is a Y-shaped band. But second option, it is superior slip attached to lower end of fibula. That is wrong. Here this one is the tibia bone. So it is attached to the medial malleolus. So here the right answer is B. Now question number 8, inferior rectal artery is a branch of. किसके branch है inferior rectal artery? A, inferior mesenteric artery, B, superior mesenteric artery, C, celiac trunk and D, internal pudendal artery. So here you can see this one is the inferior mesenteric artery. So inferior mesenteric artery, it is the continuation of the superior rectal artery. But here the question is about the inferior rectal artery. So here the correct answer is D, internal pudendal artery. It is the branch of inferior rectal artery. It is the branch of internal pudendal artery. Now question number 9, superficial epigastric artery is a branch of internal pudendal artery, B, external pudendal artery, C, internal iliac artery and D, femoral artery. See, this one is the superficial epigastric artery. Now superficial, there are 3 superficial branches of the femoral artery. But remember, if it is a superior epigastric artery, then superior epigastric artery, it is a branch of internal mammary artery or internal thoracic artery. But here it is a superficial epigastric artery, so it's a branch of femoral artery. Now the next question, last, inferior epigastric vein drains into femoral vein, B, external iliac vein, C, internal iliac vein and D, internal pudendal vein. So here this is the inferior epigastric vein, right? So inferior epigastric vein वो कहाँ पे drain करेगी? Inferior epigastric vein, it drains into the external iliac vein. See, inferior epigastric artery, it is the branch of the external iliac artery and vein also drains into the external iliac vein.